Hello, folks, and welcome back to the 7 Steps to Starting Your Medical Exercise Training Practice in Any Setting. This is Dr. Michael Jones, President of the Medical Exercise Training Institute and the founder of the Medical Exercise Specialist Certification. Well, this is step number 4. And at this point, we've talked about establishing a target marketing list, putting together a signature program, as well as establishing an introductory letter and a marketing kit. Well, step number 4 is you've got to do some research on the practitioner and the practice before making contact. Now, we talked about that target medical marketing list in step number 1. That target medical marketing list, you obviously have to determine the specialty of the practice, and I would highly recommend you identify the office manager. Now, identify the office manager by name. The office manager is going to be your best friend, or he or she is going to make or break your potential referral relationship with the medical professional. And folks, quite honestly, in the early stages, knowing who the medical professional is sufficient, but knowing who that office manager is and getting to know them is of paramount importance. That's the person you really got to get to know. Folks, for years, as I said, I was in private practice, and I had a number of orthopedic surgeons that referred to me. And it was very interesting. With the orthopedists, I very seldom spoke with them directly. For the most part, I spoke with their office managers or their nurses that work in the office. And every once in a while, maybe once a quarter, I would go around and do marketing calls where I would stop by an orthopedist's office to say hello. And I might see the orthopedist just kind of wave a hand and say hello to he or she. But for the most part, the time was spent talking to the office manager. And the office manager was instrumental in any documents we needed to have signed, any information that we needed to get on the client. It was almost always I communicated with the office manager, who in turn put me in contact with the staff member. Only seldom did I really talk to the physician regarding specific problems the client or the patient was actually having. Now, remember, I was practicing as a physical therapist then, so please be careful. If you're a fitness professional, you don't have patients, you have clients. Now, if you're a medical professional and you want to do medical exercise training, I highly recommend that you clearly understand that as a physical therapist, occupational therapist, massage therapist, you wear that hat. But when you're providing medical exercise training, you're providing services as a fitness professional, and you need to convey that directly to the client. So be very clear about that. So with regard to the research on the practitioner, again, find out the practitioner's specialty, the specialty of the practice. You'd be surprised. An orthopedic surgeon is an orthopedic surgeon, yes, but he or she may specialize in foot surgery, or they may specialize in total joint replacements. So every orthopedist or every neurologist doesn't do everything in their specialty. They may just simply specialize in a particular area of their specialty. And finding out who the office manager is vitally important. Once you find the specialty, you should also be able to determine the most common patient type that they see. Are they seeing primarily pediatric orthopedics, or are they seeing more geriatric orthopedic individuals with total joint replacements? So it becomes important that you know a little bit about the practice before you go in, and that starts with knowing the practice specialty, getting the first and last name of that office manager. So when you actually get there, and you may not be able to talk to the practitioner, which is normal, at least you can ask for the office manager by first name. And then, of course, make sure you know the client type, the common type of patient they see, so that you can now make sure you're making a presentation and you've developed a signature program that will meet the needs of that common patient type. Again, you can check out our medical exercise training certifications at postrehab.com. We have our medical exercise program director, which is our highest certification. Our most common and known around the world is our medical exercise specialist, and our post-rehab conditioning specialist is our entry-level certification for individual fitness professionals that want to offer post-rehab and or medical exercise training services. Please remember, folks, post-rehab services and medical exercise training services are pretty much synonymous. If you'd like to reach us, you can go to postrehab.com, or you can contact our office at 888-610-0923, or you can shoot me an email directly at drmike@postrehab.com. Thank you again, all the best, and hopefully you'll be around for step number 5.